Hello everyone, welcome to my channel. I'm Dr. Varun, and today we are going to discuss a very important topic which is published in the Journal of Circulation, and Circulation is the official journal of American Heart Association and one of the most renowned journal in the world. So the topic is virtual versus center-based cardiac rehabilitation, a comparison of outcomes and cost. So they have compared the outcomes of virtual cardiac rehabilitation and center-based cardiac rehabilitation. Then they have also compared the cost between the two. Okay, so before we go ahead with this important topic, I want all you to welcome to my masterclass, which is on 30th May 9 p.m. and the platform is Zoom. And what all I'm going to cover, I'm going to cover evidence-based practice, the concept of evidence-based practice, how we are going to track the latest research smartly despite of being busy with your regular schedule, and also to analyze the research using free AI tools and elevate your practice using current research and stay at par with the current research and improve your clinical practice. So let's get on to the topic, which is very interesting. So they have compared the center-based cardiac rehabilitation and virtual cardiac rehabilitation. So those who want to start practicing virtual cardiac rehabilitation, here is the study for you. Okay. So we all know that there is robust evidence supporting improved outcomes of cardiac rehabilitation, but still it remains underutilized. It is very difficult for the cardiovascular respiratory physiotherapist to call the patient or to enroll the patient in the center-based cardiac rehabilitation. So virtual cardiac rehabilitation has been proposed as an alternative to traditional center-based cardiac rehabilitation to improve the utilization rates. Okay. However, the data, what they're saying is the data of efficacy of virtual cardiac rehabilitation is lacking. So this becomes the research gap on which they have done this study. And this study is a retrospective. They're already practicing virtual cardiac rehabilitation and they have analyzed the data with center-based cardiac rehabilitation. Okay. So the duration of the study or the data was collected for center-based cardiac rehabilitation was collected from January 2018 to September 2023. That is more than 5 years of data was collected for center-based cardiac rehabilitation, and virtual cardiac rehabilitation was collected from July 2021 to September 2023. Now, virtual cardiac rehabilitation means we monitor the patient remotely. The patient is at home and we can monitor the patient via video conferencing. There are a lot of wearable devices available nowadays. There are mobile devices, mobile apps available nowadays to monitor the patient's heart rate. And we can also monitor them by video conferencing. Okay. So what all they have assessed. Okay, let's see. Okay. So they have assessed the primary outcome measures after 1 year was 1 year mortality rate, recurrent MI, all cause of hospitalization, and emergency department visits were measured, and also the primary cost was also measured between the two, that is virtual cardiac rehabilitation and center-based cardiac rehabilitation. The total cost after the 12 months of enrollment into the cardiac rehabilitation. Now coming to the results. Okay, so if you see, when they compared the results of center-based cardiac rehabilitation and virtual cardiac rehabilitation, the virtual cardiac rehabilitation associated with significant reduction in 1 year of all cause of readmission. Okay, so that was better than center-based cardiac rehabilitation. And at the end of 1 year, the emergency department also. Okay, the MI and all cause of mortality did not significantly differ between virtual cardiac rehabilitation and center-based cardiac rehabilitation. In addition, virtual cardiac rehabilitation was associated with significant reduction in the medical related and total cost. So it is cost effective, and there is reduction in the all cause of hospital readmission if you compare to center-based cardiac rehabilitation. So in these two parameters, that is all cause of hospital readmission and the total cost or the medical cost, the virtual cardiac rehabilitation was found to be better. So what they have concluded that to their knowledge or to their knowledge, the present study was the first to demonstrate the improvement in both and the clinical efficacy and the cost of virtual cardiac rehabilitation as compared to center-based cardiac rehabilitation. Okay, so you can have this virtual cardiac rehabilitation as an option in your clinical practice. The data is published in the most reputed journal, that is Circulation. So you can try your options with video conferencing or any wearable device, and follow my channel for more such updates. And if you are more interested in reading or learning or getting acquainted with recent research and how to do it in your clinical practice, you can join my masterclass. Thank you.